Have you ever stopped to think that something as simple as a small, everyday feeling might be your body's way of warning you? Imagine this. A minor symptom you've been ignoring could have been the first sign of something much more serious, something you can't afford to overlook. Cancer is one of the most feared diseases in the world, but the truth is, when detected early, the chances of effective treatment are significantly higher. Today, you'll learn about the 8 early signs that could save your life, and I ask you to pay close attention because when it comes to your health, knowing what to do can make all the difference. Now, I know that at first glance, this topic might feel uncomfortable, but don't worry, you're here for a reason. Because knowledge is power, and in this case, power means protection. Before we dive in, I urge you to like this video, subscribe to the channel and share it. This is the kind of information that can save lives, and by sharing it, you could be the one making a difference in someone's life. So let's get straight to the point. What are the early signs of cancer you should not ignore? Sign number 1, unexplained weight loss. Have you noticed you're losing weight without even trying? This might not just be about diet or exercise. Often, sudden and unexplained weight loss can be a signal that something is wrong, and it could be cancer. Tumors in the digestive system, for example, can cause this type of weight loss. Cancers like pancreatic, lung, and esophageal cancer often manifest this way. Why does this happen? Cancer can drain your body's energy faster than food can replenish it. Additionally, tumors may release substances that alter your metabolism, leading to weight loss. If you've noticed this, see a doctor immediately. Early detection can save your life. Don't wait. Take action for yourself and your loved ones. Sign number 2, extreme unexplained fatigue. Fatigue is normal, right? Everyone feels tired from time to time, especially when life gets busy or stressful. But extreme fatigue that goes beyond the usual tiredness is a sign worth paying attention to. Do you feel exhausted even after a full night's sleep? This type of fatigue could be a symptom of cancer. The disease can affect your body's ability to produce red blood cells or consume so much energy that you feel constantly drained without any clear reason. If you're experiencing this kind of fatigue, it's time to talk to your doctor. It may not be anything serious, but why take a chance? Take action now. Now take a moment to reflect on this. These might seem like simple conditions at first, but when we look closer, they are vital warning signs our bodies are sending us. These signs shouldn't be ignored. Instead, they are life-saving alerts. Sign number 3, changes in the skin. Now let's talk about something all of us can check daily, our skin. Changes in your skin, such as new moles, spots that change shape or color, or even the appearance of new lesions, could be signs of skin cancer. This includes melanoma, one of the most aggressive types of skin cancer. If you notice a mole that looks unusual or one that has changed, don't wait. A simple checkup can detect a problem before it spreads. Remember, skin cancer, when caught early, has high cure rates. And believe me, if detected early, it could be straightforward to treat. Keep an eye on your skin. Now, if you're learning something new, or if this information is making you think twice, go ahead and like this video. Don't miss the chance to keep learning, and don't forget to subscribe, because what you've seen here is just the beginning. Sign number 4, persistent cough or hoarseness. Now let's talk about something that's easy to overlook, a cough that just won't go away. If you've had a persistent cough for weeks, or even months, and it's not getting better, this could be an early warning sign of cancer, especially lung cancer. A chronic cough, along with hoarseness or blood in the sputum, should never be ignored. But it's not just lung cancer, throat cancer, esophageal cancer, and even cancers of the larynx can also present with persistent coughing. If your cough is unexplained and doesn't improve with typical treatments, please see a healthcare professional right away. Early detection is key, and it can make all the difference. Don't hesitate to ask questions if you're uncertain about anything you're hearing. Drop a comment below if you'd like more clarification on any of these signs. We are ready to answer and help you understand better. Sign number 5, changes in bowel or bladder habits. This might be a sensitive subject, but it's crucial. Changes in your bowel or bladder habits. This includes persistent constipation, diarrhea, or blood in your stool. If you notice that your bowel habits have drastically changed, or if you're experiencing pain while passing urine, this could be a signal of colon, rectal, or even bladder cancer. For example, blood in the stool can be a clear sign of colorectal cancer, which is one of the most common cancers worldwide. Don't ignore these signs, because when treated early, the outcome can be much better. And again, if you're feeling unsure or confused about any of this, we encourage you to ask questions. What you learn today can have a lasting impact on your health. So don't hesitate, your health matters. Sign number 6, difficulty swallowing or persistent indigestion. Do you experience trouble swallowing food or liquids? Or maybe you feel like you've been battling constant indigestion, even after eating small meals? These could be signs of cancer in the throat, esophagus, or stomach. If you've noticed a feeling of food sticking in your throat or chest, or if you're frequently bloated and uncomfortable after meals, it's important to get checked out. Stomach cancer, esophageal cancer, and even throat cancer often manifest with these types of symptoms. Early intervention can make a world of difference. And remember, if anything here resonates with you, feel free to drop a comment below. Sign number 7, unexplained bleeding or bruising. Bleeding or bruising that occurs for no reason should not be taken lightly. If you find that you're bruising easily, or if you're experiencing abnormal bleeding, such as nosebleeds, bleeding gums, or blood in your urine, this could be a sign of leukemia or other blood cancers. This type of unexplained bleeding happens when your blood doesn't clot properly, which can be a sign that your bone marrow is not functioning correctly. Early detection of blood cancers can significantly improve treatment outcomes. So please don't ignore these signs. Seek medical advice right away. Sign number 8, persistent pain. Last but certainly not least, pain that won't go away. We all experience pain from time to time, but when pain lingers without any clear cause, it could be a red flag. This is especially true if the pain is concentrated in a specific area, such as the abdomen, chest, or bones. Pain caused by cancer happens when a tumor presses against surrounding tissues or organs. If the pain is persistent, severe, or gets worse over time, it's a good idea to get evaluated by a doctor. It could be a sign of various cancers, including liver, kidney, or bone cancer. Remember, early diagnosis gives you the best chance at effective treatment, so never delay seeking help if you experience these warning signs. So what should you do if you notice any of these signs in yourself or someone you love? The most important thing is not to panic, but to take action. Early detection is a powerful tool in the fight against cancer, and you can make all the difference in the world by acting quickly. The first step is simple. Schedule a visit with your healthcare provider. They'll be able to perform tests and screenings to help rule out any serious conditions, or if necessary, diagnose a potential issue early on. The sooner you go, the better your chances of a successful outcome. Don't let fear or uncertainty hold you back. Most cancers are far easier to treat when caught early, and treatments are constantly advancing. So taking that first step might be the most important thing you can do for your future. Now, we know that it's not just about reacting to symptoms, but also about preventing cancer before it even starts. Prevention is always better than cure, and there are several lifestyle changes you can make that will help lower your risk. For example, did you know that smoking is the leading cause of lung cancer? Quitting smoking or avoiding tobacco products is one of the most powerful ways to reduce your risk. Along with smoking, limiting alcohol intake, eating a balanced diet, staying active, and maintaining a healthy weight. can all help protect you from various types of cancer. Also, regular screenings and self-checks are a key part of cancer prevention. Many cancers can be detected through routine screenings, things like mammograms, colonoscopies, and skin checks. Talk to your doctor about what screenings are right for you, based on your age, family history, and lifestyle. It's about being proactive, taking charge of your health, and not waiting for something to go wrong. The steps you take today can help ensure a healthier tomorrow. And again, if anything I've shared today is making you think twice, or you need more clarity, please feel free to ask questions in the comments. We're here to help, and we're committed to giving you the most accurate and helpful information possible. Your health is a conversation worth having, and we want to be part of that conversation. By being aware of the early signs of cancer, you are already ahead of the game. Knowledge is power, and the more you know, the better prepared you'll be to take action when needed. Share this video with your friends, family, and loved ones, so they too can become aware of these signs and know what to look out for. And don't forget to share your thoughts or ask questions below. No question is too small, and we're here to support you. Knowledge is meant to be shared, and together we can spread awareness and help protect those we care about. As we come to the end of this video, I want to take a moment to emphasize just how powerful awareness truly is. By now, you've learned about the early signs of cancer, the importance of acting swiftly, and how prevention plays a crucial role in reducing risk. But most importantly, I want you to understand that your health is in your hands. It's easy to feel overwhelmed or afraid when confronted with the possibility of cancer, but I want to remind you that early detection saves lives. And while cancer is a difficult topic, it's also one that we can approach with strength and courage when we are informed. With the knowledge you've gained today, you are better equipped to make decisions that could protect you and the ones you love. When you notice something unusual in your body, whether it's unexplained weight loss, persistent pain, changes in your skin, or anything else, you have the power to act on it. It's easy to ignore these signs, to push them aside or brush them off as nothing serious, but taking that first step toward a checkup or consultation could change your life. And I truly believe that the power to change your health outcomes lies in your ability to recognize those signs early on. But I also want to be clear. Taking care of yourself isn't just about reacting to problems. It's about building habits that prioritize your well-being every single day. By adopting a healthier lifestyle, committing to regular checkups, and staying informed, you give yourself the best chance at preventing serious health issues before they even arise. That's why it's so important to talk about cancer, to have these conversations with the people in your life, and to share this kind of information with your family and friends. The more we talk about it, the more we reduce the stigma and empower people to take action when they need to. Awareness is the first step toward early detection, and early detection is the first step toward treatment. It's also important to remember that you're not alone in this. If you or someone you know is facing a cancer diagnosis, or you're simply unsure about your health, there are countless resources available to you. From support groups to counseling services, to simply having a trusted family member by your side. You don't have to go through this alone. There are people and organizations ready to support you every step of the way. I encourage you to reach out to those resources, ask questions, and always keep yourself informed. There's a world of help out there, and all it takes is one phone call, one visit to your doctor, or one conversation with a loved one to begin your journey toward better health. You have the power to make the best choices for yourself, but it starts with knowing what those choices are. Remember, you are stronger than you think. If cancer is something you are facing, or if you ever find yourself in that position, always remember that many people have fought and are fighting cancer and are winning that battle. So many stories of survival and recovery show that with the right mindset, treatment, and early detection, you can overcome this. And please don't wait. If you notice any of the signs we've discussed today, don't hesitate to schedule a visit with your doctor. Early action can lead to early treatment, and early treatment is often the key to successful outcomes. Your health is your most important asset, and taking steps today can protect your tomorrow.